Since 2016, when medical assistance in dying made became legal in Canada, it became a topic that divided opinions among Muslims sharply. Some view it as a compassionate choice, while others see it as morally unacceptable. This video explores some of these contrasting perspectives among Muslim healthcare givers towards MAID. Not only Muslim, but almost all healthcare professionals often find themselves at odds over MAID. While some support it as a patient's right, others grapple with ethical concerns. The lack of consensus fuels ongoing debates in the medical community. In Islam, life preservation is paramount, making MAID a contentious issue. Many Muslim healthcare professionals face moral dilemmas balancing their faith with the demands of modern medicine.
Generally, religious teachings significantly shape attitudes towards MAID. For Muslim healthcare practitioners, these teachings often conflict with the MAID practice, leading to ethical challenges in their professional roles.
The terms used for MAID vary widely, each carrying cultural implications. Whether it's euthanasia, suicide euthanasia, physician-assisted suicide, or assisted dying, language plays a crucial role in shaping perceptions and practices. Clear definitions are vital in medical and ethical discussions. Ambiguity in terminology can lead to misunderstandings, which in turn affect both policy and practice in healthcare settings. The medical and legal literature informs us about different forms of euthanasia, each with distinct characteristics. Passive euthanasia occurs when a physician opts not to treat intercurrent diseases in patients with terminal progressive illnesses. Semi-passive euthanasia involves the withholding of nutrition and fluids from a comatose patient suffering from a terminal progressive disease. In semi-active euthanasia, a physician disconnects a ventilator from a patient with massive cerebral lesions, where recovery is deemed impossible. Accidental euthanasia happens when a physician administers narcotics for severe pain relief, which may unintentionally suppress respiration and lead to death. Suicidal euthanasia involves a physician providing drugs to a terminally ill patient, who subsequently overdoses on these drugs, resulting in their own death. Lastly, active euthanasia entails a physician administering a lethal dose of medication to a patient in the terminal stage of a severe and hopeless disease. Healthcare providers hold diverse views on MAID. Some see it as a compassionate option, while others refuse on ethical grounds. Factors like personal beliefs and professional values heavily influence their stance. For example, physicians' attitudes towards MAID can be grouped as those who 1. Perform MAID without hesitation. 2. Only perform MAID as a last resort. 3. Feel they are incapable of performing MAID. 4. Refuse MAID on the principle that dying naturally is worth striving for. Palliative care is the only option. For them, even in the Netherlands, the first country to legalize medical assistance in dying MAID, many physicians hesitate to use it as a means of providing comfort to suffering patients. Those who refuse to participate and rarely practice MAID cite personal and religious values, finding the process emotionally challenging. Dutch physicians often feel that their primary duty is to offer care and support, promoting a peaceful dying process and enhancing the quality of end-of-life care, rather than actively shortening a patient's life. Muslim physicians also often face unique conflicts, balancing their religious beliefs with medical ethics. This duality can lead to professional and personal challenges in their practice. The literature highlights that, although passive, euthanasia is practiced in some Muslim countries. For example, in Turkey, active euthanasia is a controversial practice for physicians in many Muslim countries. Even in Turkey, which endorses liberal religious rulings on these issues, physicians are not comfortable prescribing lethal injections. Nurses play a critical role in the MAID process, often being the first point of contact. Their attitudes towards MAID are complex, influenced by personal beliefs and professional responsibilities. One of the important factors that affects nurses' attitudes towards MAID is religion. For example, the nurses who adhere to the Catholic faith are more likely to be against euthanasia than members of other religious groups, particularly Protestants. Religious beliefs also significantly impact nurses' perspectives on MAID. For many Muslim nurses, these beliefs create a conflict between their faith and their professional duties. Social workers, spiritual caregivers, and pharmacists also face ethical dilemmas in MAID cases. Their roles, though indirect, are crucial in assessing eligibility and supporting patients. Interdisciplinary collaboration is essential in MAID cases. It ensures comprehensive care and addresses the ethical concerns of all involved healthcare professionals.
Muslim healthcare professionals face unique challenges, balancing religious beliefs with medical ethics. This duality often leads to professional dilemmas in their practice. A broader discussion indicates that Muslims generally do not support MAID, especially in predominantly Muslim countries. A study conducted among university students in Kuwait found that 4 main factors influence attitudes toward MAID: the patient's age, 35, 60, or 85 years, the level of incurability of the illness, completely incurable versus very difficult to treat, the type of suffering, extreme physical pain or total dependence, and how strongly the patient requests the procedure. No request, some request, or repeated requests.
Islamic legal perspectives on MAID can guide Muslim healthcare providers to manage the challenges they face in euthanasia cases. Of course, these perspectives are also diverse, reflecting a range of opinions among Muslim scholars. However, these perspectives significantly impact healthcare practices in Muslim communities. As we said, religious rulings also influence the attitudes of Muslim healthcare professionals towards MAID. Understanding these rulings is crucial for navigating the ethical landscape of medical practice. There is a pressing need for more literature and resources to support Muslim healthcare professionals. These resources can help them navigate the complex intersection of faith and medicine. This video provided a brief synopsis of the multifaceted issues surrounding MAID, from religious dilemmas to professional challenges. Understanding these complexities is crucial for informed discussions and ethical decision-making. Takeaway: by engaging with these issues, you'll gain a deeper understanding of the ethical landscape in healthcare. This knowledge empowers you to make informed decisions and advocate for compassionate care. Let's continue this conversation. Share your thoughts and experiences with MAID in the comments below. Together, we can foster a more nuanced understanding of this complex issue. Thank you for watching. If you found this video insightful, please like, share, and subscribe for more content on critical healthcare topics. Your engagement helps us bring more valuable discussions to light.